A commission appointed by Governor Baker is working on a strategy for the crisis in opioid addiction. Among the groups making recommendations is the Massachusetts Health Council, and a report focused on the role of community-based prevention campaigns. To tell us about the recommendations in the council's report is the principal researcher and the council's head of programs, Jeff Stone. Thank you very much for being with us, Jeff.
Nice to be here, Chris.
Before we get to the prevention and the community-based part of this itself, what about the landscape of risk out here in terms of the age groups and what gets people hooked on opioids?
Well, often you talked about age groups, and the strongest activity is in prevention, and it's with school-age youth in high school and middle school. That's where most of the community coalitions focus their work. And often young people might try prescription painkillers that were diagnosed legitimately for a sports injury. And a surprising number of people initially get hooked on or addicted to that kind of, to opiates through legitimate purposes like that. And then they move on to, unfortunately, to heroin as adults.
Well, we have this, what many call an unprecedented kind of crisis when you look at the overdoses, the fatal overdoses. And on the other hand, there's something like this that's been happening before, and we've addressed it before.
Well, I don't know that it's ever been quite like this before. We've also had an influx of heroin at much cheaper prices, so that you can get a bag of heroin for $5 or $7, and it's much stronger than before. I don't know why on the supply side that's happening, but most police chiefs today are saying we can't arrest our way out of this, and people are agreeing that we have to work on the demand side. In other words, reducing people wanting to use these substances, or if they're already addicted to it, helping them get into treatment and recovery.
Well, I know the substances were different, but if you go back, what is it, 10 to 15 years, we had a sense of crisis, let's say in Charlestown, and people mobilized, and I guess they accomplished something.
It's interesting you mention that, because while most of the sample of coalitions that we interviewed work on alcohol, tobacco, marijuana, and have more recently added heroin and opioids, Charlestown, Brockton, I think Springfield, and a couple of other communities were working on heroin specifically for 10 or 15 years. So it's been there, it's been a problem in some communities, but it's really spread a lot. And we were talking about the prescription painkillers. When people unfortunately become addicted through those, either through legitimately having a prescription or through trying for fun somebody else's prescription, it's expensive. Those are expensive. So as a fallback, people fall into heroin because it's, as we were saying, it's cheap and it's very deadly now.
What can a community coalition do? And what do we learn from what's happened before, at least, about that?
Well, working together with all the sectors in a community, not just police and the schools, but also the health department and the fire department and the councils on aging and the clergy association and the businesses and the Rotary and everybody else in the community. First, become educated. Realize the problem, the extent of the problem in the community, that we have had some overdoses in our community, maybe that some people have died. And then sharing information, and Gloucester is a great example. The city of Gloucester was in the news last week because the chief of police is working with the prosecutors and working with hospitals and working with the Healthy Gloucester Collaborative to funnel people who are addicted, instead of arresting them, to get them into treatment and into recovery. And he was flown to Washington to meet with our congressional delegation because that's something that came out of working together with multiple sectors within his community. That's a great example.
You also mentioned in this report some of the obstacles to solving the problem, like stigma. Mm-hmm. How is that an obstacle?
Well, this is where coalitions really can do a great thing by saying it's okay to talk about it. Same thing with mental health, even with suicide. These are things that people don't like to talk about because they're traditionally uncomfortable, and people may think that those involved are weak or immoral. We have to get away from this. And what's very important to understand about addiction, it's a brain chemical illness. When people are addicted, their brain has actually changed and it requires treatment. And they no longer can just snap out of it. So we really have to understand that people need to get treatment, and we can't arrest our way out of this problem.
What I also picture here are people who are just regular people, good families. They have one relative who's in the grip of this, and they don't know what to do.
Right. And so again, spreading the information about resources for treatment is very important. That's why I say even councils on aging should be educated. And also, the elderly are not immune to substance abuse problems. There may be alcoholism that's going on behind closed doors, and also the elderly take pain relief medications, and they're susceptible to getting addicted like any other age. So every facet of the community should at least be educated on the problem, be able to refer friends, loved ones, neighbors to treatment.
Talk about the early end of this. We have, let's say, kids in high school. I mean, I grew up with this. You know, somebody would give a lecture about the dangers of drugs. You know, it would go in one ear and out the other many times. But is there proof that this kind of thing works, at least if you do it a certain way?
Yes. The schools, for instance, do anonymous surveys of high school youth and middle school youth every year or every other year. And these are pretty reliable surveys, and they show what the young people report to the extent using different substances and what their perceptions are of their classmates using different substances. And they can track from survey to survey usage and perception of usage. And what the community coalitions are trying to do is change the social norms. In other words, the perception of whether it's okay or cool to use various kinds of drugs. And the communities that have put into place a number of educational or other kinds of programs do see reductions in the amount of usage or the amount of reported usage. So education does work.
Because part of what you have to do here is not just teach the kids something, but you've got parents, whether baby boomers or Generation X, they went through at least a phase when they might have thought this was pretty much okay to do, and now they have to look at it differently, and I guess they have to talk about it differently.
Right, right. And there are resources available for how to have that talk with your teenager. You know, if the teenager says, well, gee, you smoked marijuana when you were young, and that could, you know, for in some cases, somebody could be perplexed as to what to say. But there are good guidelines as to what to say. Marijuana has changed, by the way, in terms of its strength. Also, the scientific knowledge now about the adolescent brain and how sensitive it is and more susceptible to changes with using psychoactive substances. It gives us a lot more knowledge right now than we had years ago. With marijuana being stronger and these other substances, it really is dangerous for the brain, for the development of the brain, to use these substances for any age, but especially for adolescents before their brains are fully formed.
Because one of the main reasons you're making these recommendations about community-based response is that you want the governor and the state legislature to push this ahead. So what do you think they need to do?
Well, just in the past week, it's almost right after our report came out, the governor did announce a new set of grants to support community coalitions. I'm not going to connect it directly with our report. A lot of people have been saying this. So that was out just in the last week. There are also cluster coalitions, cluster communities. So some communities are more advanced in terms of doing this substance abuse prevention work. So they're giving grants to clusters of 3 to 7 communities, and they will work together and meet together and do programs together just to make it more efficient and more effective.
And is this something you just do when there's a crisis and then everybody can relax and forget about it?
Well, I think we're in a long-standing crisis right now, unfortunately, and we have to work. We can't let up. And the coalition coordinators are very concerned about doing it in a way that has both impact and sustainability. So they want to make sure they get everybody on board and everybody working in a consistent way over time. It's said that it takes years to really change the social norms in a community, and that's why some of the grant programs are for several years at a time.
Jeff, if anybody wants any more details, I think you've got something on your website at the council there?
Yes, this new report's a 42-page report. It's on our homepage, which is www.mahealthcouncil.org.
Thank you very much for being with us, Jeff Stone.
Thank you very much.
Jeff Stone from the Massachusetts Health Council. We'll have more news in just a moment.